Hello guys, welcome to Rebuild Academy. My name is Adil Momin and I welcome you to the 13th part of our series From Virus to Vaccine, Let's Fight Infodemic. I hope you all are doing well, fighting pandemic as well as infodemic. But before we begin, let me tell you a very important point. It is extremely important and highly recommended to watch this series in order. Only then you will get a complete idea and a clear picture of every concept involved. The link is given in the description. Now, let's begin. In a previous couple of videos, we talked about medical treatment methods in modern medicine. We have talked about preventive treatment, in which we discussed COVID appropriate behavior and immunization and major aspects related to vaccination in the previous video, after which we discussed symptomatic treatment and curative treatment. This concludes our discussion on treatment. Today we will discuss post-COVID conditions, in which we will mainly discuss major possible conditions that people can experience after recovering from COVID. You might have heard about long COVID. We will know what it is. Also we will discuss multi-organ effects and treatment effects of COVID. Moving forward, we will talk about mucormycosis. We will briefly go through its diagnosis, treatment, prevention, and risk factors. And we will also see why a majority of the cases emerged from India. Then we will discuss post-traumatic stress disorder, that is PTSD, and briefly go through its symptoms, treatment, and risk factors. Okay then, let's begin. Before starting this topic, I want to mention that this topic is one of the emerging topics related to COVID. As we move forward, more such conditions will come to light. So, based on information reported and available in the public domain as of now, I want to start today's discussion. Post-COVID conditions can be broadly classified into three categories as long COVID, multi-organ effects, and effects of COVID treatment. Long COVID refers to when people continue to experience symptoms of COVID and do not fully recover for several weeks or months after the start of their symptoms. Some research suggests that people with mild cases of COVID-19 usually recover within 1 to 2 weeks of contracting the infection. For severe cases of COVID, recovery can take 6 weeks or longer. So, research suggests that if symptoms persist more than 12 weeks, then it can be a case of long COVID. Common symptoms include fatigue, breathlessness, cough, brain fog, insomnia, depression, and anxiety. The phenomenon appears to be more common among people who have experienced more severe infections, and the people affected sometimes call themselves long haulers. Multiple studies and researches are being conducted around the globe for investigating causes and potential treatments for long COVID. Some people who had severe infections may experience multi-organ effects or autoimmune conditions over a long time, with symptoms lasting weeks or months after infection. Multi-organ effects can affect most, if not all, body symptoms, including heart, lung, kidney, skin, and brain functions. While it is very rare, some people, mostly children, experience multi-system inflammatory syndrome, that is MIS, during or immediately after COVID-19 infection. MIS is a condition where different body parts can become inflamed. MIS can lead to post-COVID conditions if a person continues to experience multi-organ effects or other symptoms. Moreover, some patients have been reported to develop autoimmune diseases such as Guillain-Barré syndrome, a condition in which the immune system attacks the nerves. Hospitalization and severe illnesses for lung-related diseases, including COVID, can cause health effects like severe weaknesses and exhaustion during the recovery period. Effects of hospitalization can also include post-intensive care syndrome (PICS), which refers to health effects that begin when a person is in ICU and can remain after a person returns home. These effects can include severe weakness, problems with thinking and judgment, and post-traumatic stress disorder. PTSD involves long-term reactions to a very stressful event. We will discuss it shortly. Some symptoms that can occur after hospitalization are similar to some of the symptoms that people with initially mild or no symptoms may experience many weeks after COVID. It can be difficult to know whether they are caused by effects of hospitalization, the long-term effects of the virus, or a combination of both. These conditions might also be complicated by other effects related to COVID, including mental health effects from isolation, negative economic situations, and lack of access to health care for managing underlying conditions. These factors have affected both people who have experienced COVID and those who have not. Now let's talk about mucormycosis, popularly known as black fungus. It is a serious but rare fungal infection caused by a group of molds called mucormycetes. These molds live throughout the environment. Mucormycosis most commonly affects the sinuses or lungs after inhaling fungus spores from the air. It can also occur on the skin after a cut, burn, or other types of skin injury. The symptoms of mucormycosis depends on where in the body the fungus is growing. Symptoms of rhinocerebral mucormycosis include one-sided facial swelling, headache, nasal congestion, fever, and black lesions on the upper side of the mouth that quickly become more severe. This type of infection is more common in people with uncontrolled diabetes. Symptoms of pulmonary mucormycosis include fever, cough, chest pain, and shortness of breath. People with cancer are more susceptible to pulmonary mucormycosis. Symptoms of gastrointestinal mucormycosis include abdominal pain, nausea and vomiting, and gastrointestinal bleeding. Children are an easier target for gastrointestinal mucormycosis. Cutaneous mucormycosis can look like blisters or ulcers, and the infected area may turn black. Other symptoms include pain, warmth, excessive redness, or swelling around a wound. Skin trauma can be a possible reason for skin mucormycosis. If we want to know why mucormycosis is named black fungus, then it is important to know that mucormycosis is an ageno-invasive fungal infection. The fungus has a tendency to invade blood vessel walls, causing tissue necrosis. Necrosis is the death of body tissues. It occurs when too little blood flows to the tissue. When tissues die, they turn black, and hence the name black fungus is misleading because the color of fungus is not black, it's the dead tissues that turn black. It is important to note that mucormycosis is not contagious, therefore it does not spread between people. Mucormycosis is an opportunistic infection because it mainly affects people who have health problems or take immunosuppressive drugs for the treatment of autoimmune diseases. Therefore, if we talk about the risk factors, it includes diabetes, cancer, organ transplant, low WBCs, skin injury, and long-term use of corticosteroids. Now you will understand the link between mucormycosis and COVID. We know that in the treatment of COVID, especially in severe cases, glucocorticoids are used, which are immunosuppressive drugs. Using these drugs makes the person susceptible to fungal infection. And if we want to link between India and post-COVID mucormycosis cases, then there is a couple of points here. The first one is cases of mucormycosis in India was already multiple times higher than the global average from pre-COVID times. And second, if you don't know, India is known as world's capital of diabetes. In most households, diabetes is also known as sugar or sugar disease. The diabetic population in the country is close to hitting the alarming mark of 70 million by 2025 and 80 million by 2030, witnessing an increase of staggering to 66%. The studies have shown that diabetes is more prevalent in the urban areas as 28% of the population living in cities are affected, whereas 5% of the rural population are positive with diabetes. So, if you see the number of people who got mucormycosis after COVID, then people with diabetes hold a majority in them. The diagnosis of mucormycosis involves culture and biopsy. In biopsy, the tissue sample is taken from infected area and are cultured and observed under the microscope. Culture from biopsy samples does not always give a result as the organism is very fragile. To precisely identify the species requires an expert. It should be noted that an autopsy is different from biopsy. An autopsy is the process of dissection and examination of dead body and its organs, mainly for finding the cause of death. It is also called as post-mortem. A post-mortem may also be performed to establish the evolution and mechanisms of disease processes for research purposes. Now coming back to mucormycosis, imaging is often performed such as CT scan of lungs and sinuses for diagnosis of mucormycosis. Treatment involves a combination of antifungal drugs, surgically removing infecting tissues and correcting underlying medical problems. Preventive measures include wearing a face mask in dusty areas, washing hands, avoiding direct contact with water-damaged buildings, and protecting skin, feet, and hands where there is exposure to soil or manure such as gardening or certain outdoor work. In high-risk groups such as organ transplants, antifungal drugs may be given as preventive treatment. Now let's talk about post-traumatic stress disorder, PTSD. PTSD is a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event. Trauma is an emotional response to a terrible event. The terrible event can be physical, psychological, or sexual abuse. It can be traffic collision or natural disaster like earthquake, cyclone, or wildfire. The loss of a loved one like a mother or a child can cause PTSD. Some women can experience PTSD due to trauma caused by childbirth. Life-threatening illnesses like coronary artery disease can also lead to PTSD. The effects of trauma can be short-term or long-term. PTSD has been known by many names in the past, such as shell shock during the years of World War I and combat fatigue after World War II. But PTSD does not just happen to military persons, it can occur in all people of any ethnicity, nationality, or culture at any age. PTSD affects approximately 3.5% of US adults every year, and an estimated 1 in 11 people will be diagnosed with PTSD in their lifetime. Women are twice likely as men to have PTSD. People with PTSD experience emotional as well as physical responses. The emotional responses can be denial and confusion. They have intense, disturbing thoughts and feelings related to their experience that last long after the traumatic event has ended. They may relive the event through flashbacks or nightmares, which can make them depressed and anxious. They may feel guilt, fear, or anger and feel detached or estranged from other people. People with PTSD may avoid situations or people that remind them of the traumatic event, and they may have strong negative reactions to something as ordinary as loud noise or an accidental touch. The physical response can be headache, fatigue, sweating, racing heart, hyperarousal. Hyperarousal is a condition in which a person's body suddenly kicks into high alert as a result of thinking about their trauma. Digestive symptoms are also associated with physical responses due to PTSD. If we talk about risk factors of PTSD, then people who have experienced previous trauma are at more risk of PTSD. A person dealing with physical injury or pain, if exposed to trauma, are susceptible to PTSD. Even no or little support after trauma can make the person vulnerable to PTSD. It is important to note that people dealing with anxiety and depression are prone to developing PTSD. The treatment methods of PTSD involves therapies, medication, and self-care. Cognitive behavior therapy, that is CBT, is a type of treatment that helps people to learn how to identify and change destructive or disturbing thought patterns that have a negative influence on behavior and emotions. The underlying concept behind CBT is that thoughts and feelings play a fundamental role in behavior. For example, a person who spends a lot of time thinking about plane crashes, runway accidents, and other air disasters may avoid air travel as a result. Cognitive behavior therapy aims to teach people that while they cannot control every aspect of the world around them, they can take control of how they interpret and deal with things in their environment. One of the greatest benefits of CBT is that it helps clients develop coping skills that can be useful both now and in future. Eye movement desensitization and reprocessing, that is EMDR, therapy is an extensively researched, effective psychotherapy method proven to help people recover from trauma. During EMDR therapy sessions, you relive traumatic or triggering experiences in brief doses while the therapist directs your eye movements. EMDR is thought to be effective because recalling distressive events is often less emotionally upsetting when your attention is diverted. This allows you to be exposed to memories or thoughts without having a strong psychological response. Over time, this technique is believed to lessen the impact that the memories or thoughts have on you. It's thought to be particularly effective for those who struggle to talk about their past experiences. Somatic therapy aims to treat the effect of PTSD through the connection of mind and body and uses a body-centric approach. Unlike standard mental health therapy like CBT that focuses prominently on the mind, somatic therapy incorporates body-oriented methods such as dance, breath work, and meditation to support patients through their healing journeys. This therapy aims to help realize how a physical body holds on to stress and trauma, rather than only resolving problems verbally. Along with therapies, medication can be used for symptom management, but self-care is one of the crucial aspects of PTSD treatment. Exercises are not only helpful in maintaining a healthy body, but also in maintaining a healthy mind. Meditation has multiple benefits like reducing negative emotions, gaining a new perspective on stressful situations, and increasing imagination and creativity. A balanced lifestyle, having a balanced diet, and proper sleep can not only strengthen your immune system but also enhance your stress management ability. Aristotle, the legendary Greek philosopher, said, "Man is by nature a social animal. Man cannot live alone. He must satisfy certain natural basic needs to survive. He has to enter into relationships with his fellow men for living a life. No man can break the shackles of mutual dependence. This begins perhaps between the embryo and the mother and continues till his last breath. The need of the embryo may be more physical than mental, but the mother's need is other way round. Therefore, connecting with others can help you in more than one way to develop and grow. People recovering from trauma are in need of emotional support. You can show emotional support by offering genuine encouragement, reassurance, and compassion. This might include things like verbal expression of sympathy or physical gestures of affection. Emotional support can come from other sources too. like religious or spiritual sources, community activities, or even your pets. Whatever form it takes, this support can improve anyone's outlook and general wellness. So, this brings us to the end of today's discussion. Now, as usual, let's quickly revise the topics we discussed today. Today we started our discussion on post-COVID conditions. First we discussed long COVID. Some people, especially those who recovered from severe infection, can experience COVID-like symptoms for weeks after recovery. Then we learned that even COVID is a respiratory tract infection, but it can affect many body systems and can be responsible for diseases like multi-system inflammatory syndrome, MIS, which is observed especially in children. After which, we talked about post-COVID conditions, which are after effects of COVID treatment like severe weaknesses, post-intensive care syndrome, and PTSD. Moving forward, we discussed mucormycosis, popularly called a black fungus. We learned that it is not the fungus that is black, but the dead tissues. We saw that long-term use of corticosteroids and diabetes increases the susceptibility to mucormycosis. Otherwise, it is a rare fungal infection. And in the end, we talked in length about post-traumatic stress disorder. We saw how different terrible events can induce emotional and physical responses in people even after they pass. We also discussed different therapies like CBT, EMDR, and somatic therapies used in the treatment of PTSD. And we got to know that self-care through exercise, medication, and a balanced lifestyle coupled with sufficient emotional support from others is crucial in recovering from trauma and PTSD. In the upcoming video, we will be finally discussing pandemic, different stages and phases of pandemic, also how pandemics are controlled. So, make sure you subscribe the channel and press the bell icon for timely notifications. If you enjoyed and learned something from this video, then make sure that you like the video and share it with others so that we all work together and battle the infodemic. If you have any suggestion for me, then you can comment below. That's all for now. We will meet in the next video. Stay safe, stay connected.